You know that feeling, right? You stand up a little too fast and for a second, the world just spins. Well, that super common feeling actually has a name. And today, we're going to explore it through this really cool story about a retired doctor and his granddaughter. It's a lesson that, you'll see, goes way beyond what you'd find in any textbook. So let's set this scene. It's a quiet afternoon, and Nancy, who's in her final year of med school, is just having some tea with her grandpa Yogesh. But then, as he gets up from his chair, he suddenly has to stop, steady himself on the table. And Nancy, of course, sees this, and she's immediately concerned.
But Grandpa Yogesh? He doesn't see this as some moment of weakness. No way. For him, this is the perfect teachable moment. He tells her, this is postural hypotension. And for Nancy, who's literally studying this stuff right now, she is all ears. And, well, this is where we get to dive right into the science behind it all.
All right, so first up, gravity and your brain. Let's talk about the science of just standing up. What is actually going on inside our bodies in that simple moment? It really all comes down to a battle between your own circulatory system and a force we all know very, very well, gravity.
So Grandpa Yogesh kicks things off with a pretty simple question, and it's for Nancy, but it's for us too. When you stand up, what happens to all the blood in your body? Where does it want to go? Seriously, think about it for a second. The answer here is the key to understanding literally everything that comes next.
And the answer is down. Simple as that. Gravity immediately pulls about half a liter of your blood down into your legs and your belly. Now, here's what's so fascinating. This sets off a chain reaction. See, less blood getting back to the heart means less blood is getting pumped out. And the most crucial part, less of that oxygen-rich blood is getting to your brain. That is the trigger for that dizzy, whoa feeling.
Okay, but our bodies are incredibly smart, right? In a healthy person, this amazing, super fast reflex just kicks right in. It happens in seconds. So step 1, you stand up, gravity pulls the blood down. Step 2, these little sensors, they're called baroreceptors. They detect that pressure drop and they basically sound the alarm. Step 3, the brain gets this urgent message. And then step 4, the body corrects. The brain tells the heart, hey, speed up, and it tells the blood vessels to tighten up and push that blood right back where it belongs.
And this really shows the difference perfectly. So on one side, you've got the normal response. The sensors work, the brain responds like it's supposed to, and your blood pressure stabilizes. You feel totally fine. But then, on the other side, in orthostatic hypotension, that reflex is slow. It's weak. The brain's response is delayed, so your blood pressure just stays low for too long. And that's exactly when you feel dizzy.
Okay, so we've got the why. Now let's talk about the what. How do doctors go from just a feeling of dizziness to an actual clinical diagnosis? Well, it all comes down to some very specific numbers. Let's take a look.
The first number you absolutely have to know is 20. That's 20 millimeters of mercury. As Grandpa Yogesh explains, a diagnosis requires a drop of at least 20 millimeters of mercury in your systolic pressure. That's the top number when you get a reading. And this has to happen within just 3 minutes of standing up.
And the second key number is 10. So let's say that top number, the systolic, doesn't drop by 20. The next thing doctors look for is a drop of at least 10 millimeters of mercury in the diastolic pressure. That's the bottom number. You only need one or the other for a diagnosis.
So, let's put it all together. Here's the official definition of orthostatic hypotension. It's that specific drop in blood pressure, at least 20 on the top number or 10 on the bottom, that happens within 3 minutes of you standing up. That's the whole shebang right there.
And look, those numbers on a blood pressure cuff, they translate into very real physical feelings. We're not just talking about dizziness. It can be lightheadedness, blurred vision, a general feeling of weakness, or even, in more severe cases, actually fainting. The clinical term for that is syncope. This is exactly why Grandpa Yogesh is smart and holds on to something when he stands up.
So this brings us to the next big question, right? If this is all because of a reflex that isn't working right, well, what causes that reflex to fail in the first place? Let's trace the causes.
And this is exactly what Nancy wants to know. She asks her grandpa, why? Why does this happen to some people and not others? And the answer, as it turns out, is, well, it's not so simple. There's no single, easy answer here.
As Grandpa Yogesh lays it out, it could be a whole bunch of different things. I mean, it could be something as simple as just not drinking enough water, dehydration. But it can also be a sign of more serious stuff, like heart problems, diabetes, or even Parkinson's disease. Heck, even certain medications or just eating a really heavy meal can trigger it. And for older folks, it's often a mix of a few of these things all at once.
Okay, so we've talked about the problem, and we've talked about the causes. So what can you actually do about it? Let's dive into one of the main treatments that Nancy and her grandpa talked about, a medicine called Midodrine.
So Grandpa Yogesh brings up this medication, Midodrine. And the way it works is honestly kind of brilliant in how simple it is. It basically just counteracts the problem head on. If gravity is making your blood vessels relax and letting the blood pool, Midodrine steps in and helps tighten them back up. That forces the blood pressure right back to where it should be.
And Nancy, because she's a great medical student, she immediately chimes in and recognizes the drug's class. She says, oh, that's an alpha-1 agonist. And that's exactly right. This type of drug works by activating these specific receptors on your blood vessels, basically telling them to constrict, to squeeze tighter, and to fight back against gravity's pull when you stand up. So by the end of their chat, Nancy has this incredibly clear picture of what orthostatic hypotension is all about. But her grandpa, he has one last lesson to share. And honestly, it might be the most important one of all.
And this quote really gets to the heart of everything. He tells her, medicine isn't just about books, Beta. It's about stories, people, and listening to the body's whispers. And that's it, isn't it? Understanding all the numbers and the science is absolutely crucial. But real medicine, that's about connecting all those facts to a person's actual story. It's about listening to those subtle clues, the body's whispers, to really get the whole picture. It's just such a powerful reminder that behind every single diagnosis, there's always a person.